So this comes from Twitter. This is Mar at Marissa. In your experience, what conditions have you found cannabis to be most effective in treating? So this is a great question, and I'm probably going to give you a few different conditions. And no, I don't think cannabis is magic, but it does treat more conditions than the average pharmaceutical. Most pharmaceuticals are created to treat one particular condition. Sometimes in the studies, they find that there's this wonderful side effect, then it does happen, then it can be used to treat someone else. And actually, that's how Viagra got discovered. It was to be used for pulmonary hypertension, which it still is. But some of the participants in the study said that they had a nice side effect, and they let the researchers know, and Viagra was developed. So interesting. Coming back to what I found cannabis to be most effective in treating, I'm really going to start with insomnia and anxiety. And I'll keep them separate, but they are sometimes a little bit difficult to not group together. And the reason why I'm saying this is because just so many people suffer from insomnia or anxiety. Depending upon what paper you look, it could be 10% upwards to 40% of people suffer from insomnia or anxiety. We're looking at close to almost like 1 out of 2 people. We live in a very fast-paced world right now. There's a lot of demands. People are on their phones all the time. There's screens, people have kids. Like there's a lot going on right now that a lot of our ancestors did not have to deal with. So I understand why people are feeling more anxious today than they were in the past. So let's just start with insomnia. So insomnia, if you don't know, that's trouble falling asleep or staying asleep. Some people have one, some people just have the other. And it does become a little bit different as to how you should treat yourself with cannabis if you have different issues falling asleep versus staying asleep. So if your issue is just with falling asleep, some people can get away with just vaping. Now, if vaping is not your thing, I completely understand. There's mixed evidence out there right now with vaping. There's some people say that it can harm your lungs. I haven't really seen anything definitive on that whatsoever. But again, some people just don't like the idea of inhaling and vaping. If that's you, then you would want to use something like an edible or an oil or a tincture, something that you orally ingest. But coming back to insomnia, like it's good to start out just with CBD only, so cannabidiol. So CBD it's not going to make you high. I won't use the term non-psychoactive because technically, like caffeine is psychoactive. It does induce a change in your mental perception or cognition, and CBD does that, of course, but it doesn't make you high. So some people do get it with just using CBD only. Take this with a grain of salt, but I did a poll on my Twitter, I remember, maybe it was a year or 2 ago, and they said about 15% of people who use cannabis to sleep just use CBD only. So again, not that high of a percentage, but some people do get away with just using CBD only. Most people do need to use a little bit of THC. I always recommend, though, not using more than a 1-to-1 ratio. So don't use more THC than CBD. And there's a couple reasons for this. So the first is that if you just continuously use high THC, you can develop a tolerance to it. Now, I know some people don't like to hear that, especially the cannabis people who are just hardcore on cannabis only. Everything else sucks. There are some caveats to using cannabis, and one is definitely if you use high THC, then you can in fact induce a little bit of a tolerance. It might be amazing for your sleep at first, but then over time, that will diminish. I do think that if you are using cannabis for sleep, you want to use something more in like a 1-to-1 ratio, equal parts of THC to CBD. And when would you want to take them before bed? If your issue is falling asleep and it's just falling asleep, again, you may get away with just vaping. And then once the vape is out of your system in 2 or 3 hours, if it's just issues of falling asleep, then you stay asleep fine, then you should be okay. If you have issues with staying asleep, when edible is definitely the better way to go. It's going to be in your system, say, for 6 to 8 hours, as opposed to, say, 1 to 3 hours. So that'll help you stay asleep. Now, obviously, though, if you take it, say, an hour before it kicks in, then it will help you get to sleep as well. That would be my strategy around using THC and CBD for insomnia, which, again, to answer Marissa's question, is I think is potentially the most effective ailment to treat with cannabis. But again, I can't leave out anxiety. Again, a lot of people suffer from anxiety disorders. It could be general anxiety where you worry about things that maybe you shouldn't be worrying about all the time. Some people suffer from social anxiety, so they're fine when they're on their own. They don't really worry too much, but then they go out in public or have to do some public display, an event, video, podcast. They become a little bit shy and they just don't feel comfortable. So I do think there is quite a bit of evidence now. Again, albeit a lot of it is anecdotal. We do need a lot of the science to catch up. That being said, there is some evidence, that hardcore evidence on PubMed, you can find that CBD does in fact reduce anxiety and can be very effective for people. And if you are an anxious person and that's the reason why you can't fall asleep, sometimes using a little bit of CBD can help ameliorate that anxiety, and then that can help you fall asleep. CBD can be helpful for insomnia and it can be helpful for anxiety. But when it comes to anxiety, definitely start with just CBD only, particularly if you've never used any CBD before. A lot of people can control their anxiety just with CBD only. I can't give you a percentage. And again, like the 15% I said with insomnia is just off a Twitter poll. Again, take it with a grain of salt. But a lot of people, I think well over 50%, can just use CBD only and get tremendous results with reducing their anxiety. And a question that often comes up is, can you potentially get off some of your antidepressants when you use CBD? And the answer is yes. I've seen a ton of patients come off of their antidepressants when they use CBD to help treat their depression or their anxiety. Again, Mar, thank you so much for that question. And hopefully that answers the big one for most people, which is insomnia, stress, anxiety. But that being said, there are a lot of other conditions that cannabis can be helpful for treating. So I'm just going to go through a little bit of a list. Seizure disorders. If you're a cannabis user or cannabis advocate, you've probably seen or heard about some of the Sanjay Gupta videos that he did called Weed on CNN a few years ago, where there was this strain called Charlotte's Web that was made that was a high CBD strain. And so it stopped Charlotte's seizures. So Charlotte was a little girl living in Colorado, and she used CBD and it did help stop her seizures. And I've seen that with many of my patients as well. And I'm actually going to bring up one of those patients a little bit later on because it was very impactful, not just for her and for her mom and for her family, but also had a big impact on me and the people that I work with as well. Muscle spasms though too, and muscle pain, CBD can be fantastic for that. Every second MMA fighter out there these days seems to have their own kind of CBD cream, or at least they're promoting someone else's CBD cream. So if you take it orally, it can be helpful, meaning if you take an edible, it can be helpful for reducing inflammation, reducing muscle spasms, reducing that muscle pain. So a lot of people do take it after they work out. And that is probably one of the ones that I get asked about the most, just because, again, there's so many people who are suffering from chronic pain. And a lot of those people have found relief with CBD. On that note, though, CBD and THC do work differently for treating pain. So CBD, again, it has more of an anti-inflammatory effect. It's really good for muscle pain. But if you have neuropathic pain, like if you have sciatica, like shooting, numbness, and tingling pain, CBD can be effective, but maybe not as effective as a combination of THC and CBD. So the reason being is that THC just works really through dissociations instead of, because if you have pain in your knee, say, the pain isn't coming necessarily from your knee. It's a signal that's going to your brain that's telling you that you're in pain. And so THC can block that signal, at least diminish it so that you feel like you're in less pain overall. And it does have some anti-inflammatory effects as well. I know a lot of people use CBD and THC for reducing pain, and that's how I would use them. And the balms can be super helpful as well. It's always helpful sometimes just to be able to rub something right on the area. And you can absolutely get really good results with that, with using THC and CBD only. So again, Mar, thank you so much for that question. I really do appreciate that. And hopefully I answered that as well as you wanted to.